It's a great thrill to be back in Edinburgh. I was struck by several things during the presentations that I've been listening to. First of all, the parallels with the development of cortisol and the development of penicillin, both discovered in the early part of the 20th century, but only developed and manufactured in large enough quantities to make a difference in the Second World War, and that the demands of the combat and the needs of the soldiers in the battlefield stimulating everyone to come together, and truly how that was a partnership. On the subject of education, I've called my talk "Education Changes Everything" because I believe that. And in fact, the previous speakers, as Stephen was talking about, Kendall's talk about his acceptance speech, that cortisol is new in as much as it has been made available. I believe the same is true about education. It's there. Our goal is to make it available. In all the work that I've been involved in corporate social responsibility, particularly with HIV and AIDS in Africa, I've been asked many times, did I think that there is a magic bullet to solve the issues, particularly of HIV and AIDS in Africa? And of course, no one expects you to say yes. Everyone expects you to say, well, no, we all have to work together, and there need to be partnerships, all of which is true. But I do believe that there is actually a magic bullet for dealing with many of the public health issues in Africa. And that is educate girls. When you say that in an African environment, usually the women nod vigorously and the men shift uncomfortably. But I believe it. And it is also my belief that most, if not all, public health challenges that we face can be traced back to some kind of inequity. We heard from Francisca about the inequity of preschool children not being given the bilharzia treatment, not being exposed to that. Those inequities can be across gender lines, age lines, ethnic or racial lines. But what I'd like to talk about is a program, small, but I believe already delivering results, by addressing something as simple as giving girls the opportunity in 4 African countries to be educated. Now, this is a program that is run by, through the aegis of the International Council of Nurses, the ICN, and through national nursing associations in the 4 countries that I'm going to talk about. So why give girls a chance to be educated? Well, it's obvious to all of us sitting here, but that doesn't happen in large parts of the world. The biggest risk for a woman in large parts of Africa to get HIV is to be married. She can't negotiate within her marriage whether she can insist on her husband wearing a condom, for example. And often for a girl born into poverty, the easier and more obvious way out is to marry a richer and older man, putting herself at enormous risk from a health perspective, possibly solving part of the economic situation. But from a health perspective, it is a ticking time bomb. So this program is called the Girl Child Education Program, and it is supported by the Girl Child Education Fund. And I think it is one of the most inspired programs that I've ever come across. And when I found out about it through one of my colleagues in my group in Pfizer in New York, I immediately said, we need to be involved with this. We need to support this because it makes so much sense. All the reasons that I think you know. The Millennium Development Goals are looking at addressing education for all, primary education particularly for all, maternal health, child life and health. If a girl is educated and has an opportunity to go into a profession, she's less likely to get married, certainly less likely to get married early. She's less likely to have as many children. She may even defer having her children till much later in life. There will be lower birth rates. Women, in some societies in Africa, have a much stronger role. I think we all know that. But for women to be given the opportunity to play a political role in their society will change everything. For a start, they all make much better healthcare choices than men do. I think we know that. You just need to walk out onto George Street to see that as well. And it helps protect girls from abuse, from HIV, AIDS, and from other diseases. I visited a orphanage in the outskirts of Nairobi recently, and their youngest pregnancy in there was a girl of 10. That's just heartbreaking. And you wonder if it's even possible, but clearly it is. And that girl probably has no future. And that is wrong. So the basis of this program is that girl children who are orphaned, whose mother was a nurse, are entered into this program, are matched up, the sisterhood of nurses whom this girl's mother worked with, go into action and support that girl, encouraging her to stay at school, encouraging her perhaps to go into nursing. I know it is perhaps sexist to say that most nurses are women, but certainly in Africa that is the case. Most nurses are. It is a female profession. And to encourage those girls to perhaps stay in education, perhaps become nurses, perhaps go on to become doctors, or other professions. The goal is to encourage them to stay in education. So, orphan daughters of nurses, it's primary and secondary education. It's mostly residential, it's mostly boarding school, because the girls are still very vulnerable if they remain in their own community. They sometimes do stay in the community, and it depends very much on how much financing is available. But the goal is to really get them into a uniform, to get them educated, to give them books, and to give them the love of learning. They're matched to nurse volunteers within their community, and they keep going with the program over the years of their school. The program is now active through the national nursing associations in Kenya, Swaziland, Uganda, and Zambia. Girls can sometimes fall out of the system when the mother dies, because the brothers need to be looked after. All that washing at the riverside needs to be done, and the boys are not going to do it. It falls to the girls to do that. So therefore it is very easy for them to fall victims to being orphans and to fall out of the system. But having educated girl children in society, I think we would all agree, pays enormous dividends. It also says a tremendous amount of the solidarity, global solidarity of the nursing profession. And we overlook that. And nurses really understand what happens in their community. So the Global the Girl Child Education Fund, you can see here, it's giving access to education, but it's giving so much more. It's building the families back together again, and it's reintegrating girls along with their families into their communities. I've mentioned some of these factors, but if you have 48 million orphans in sub-Saharan Africa, 12 million of them are as a result of the HIV pandemic, but not all of them. And as you saw from some of the earlier slides, while pneumonia, infectious bacterial pneumonia, is probably the leading cause of death, certainly in children under the age of 5, far more than malaria and HIV added together, it is still also a serious problem for adults. So it's not just HIV. There is malaria. There are all the other diseases. And we're now starting to see, as people are living longer because of the access to antiretrovirals, non-communicable disease, which is starting to be a significant issue. It is as much an issue in India, for example, as infectious diseases are. And we will start to see that spreading across sub-Saharan Africa as well. The feminization of HIV and AIDS I've talked about as well, and gender bias. Whenever there is a gender bias like that, I firmly believe that a public health issue is the one that develops from that. So if you have homeless children, chronically ill guardians, etc., poor nutrition, which we've heard about, low basic care, and education a low priority, then the society is very much the poorer as a result of that. So this program has only been going for 6 years, and we're only talking in the hundreds. But what I wanted, the title of this meeting today is, do we really have the evidence? Well, I put it to you that these small numbers from 4 countries are very compelling evidence. First of all, the attrition rate, that is the girls dropping out, is very low. And it's mostly because they have found other sponsors. Other sponsors have come into the community. People do occasionally relocate. The occasional teen pregnancy, and when you have a teen pregnancy rate of 25% in some of these communities, it's amazing that it is as low as it is in this program, and that tells me that this program is in fact working. When the general population, or a quarter of teenage girls, are at risk of becoming pregnant, then I think that this program has really reduced that greatly. So we've recruited recruited about almost 300 now, and completing secondary school within 6 years. I think these results, to have 33 post-secondary education, I think that is very, very hopeful, and that is, I think, where we can expect some great results in these communities to come forward. And these are just some of the examples of what people feel about the program. I think it raises the image of nursing and the national nursing associations as well. This is one of the girls in the program in Kenya. The program has become her parents, and without it, she would not be able to survive. It is the ICN, the International Council of Nurses, that raises money for this. This is Florence, their bear. And they raise money in all sorts of ways to do it, from the private sector as well. You can see central and national leadership and various donors, and I'm happy that Pfizer does provide funding for this. But the point is that if you start at something as basic as education, all the other very advanced science that we've heard about has far more chance of being successful. And all the other new medicines that we will hopefully develop will all have far more chance of being successful, because the structure is in place. Now let me say something very, very important in closing. I believe the answers to Africa, I believe the answers to any problem in any culture lie with that culture. The answers to the issues that Africa faces lie in Africa. I do not have those answers, nor would it be right for any of us to go and say, here are the answers. But I do believe that an academy like the Global Health Academy at Edinburgh can partner and can help free up resources, intellectual capital and intellectual property that cultures and societies can choose to use to make a difference. And that is what I believe something like the Girl Child Education Fund can do to free up and unleash the incredible talent that is to be found in the African continent. And it's why we support it. I'm very happy to take any questions about this program. It is simple, but it's staring us in the face, and I think it is something that can make an enormous difference. Thank you very much.